I am Dr. Chiadi Ndumele. I am a cardiologist and an associate professor in the Department of Medicine at Johns Hopkins University.
And I'm Dr. Janani Rangaswami. And I'm a nephrologist. I'm a professor of medicine at the George Washington University School of Medicine.
You know, in order to really personalize the approach to care, we also have to recognize that there's additional factors that are above and beyond the stages that can affect individuals' likelihood of progressing along this spectrum of CKM syndrome. So having a chronic inflammatory condition like lupus or rheumatoid arthritis can certainly increase your likelihood of progression. Mental health conditions, particularly things like depression and anxiety, can affect multiple aspects of your behaviors. Certainly the medications can even affect adiposity levels, but in multiple ways they can affect CKM syndrome progression. There's certain high-risk demographic groups. So we've talked a lot about low socioeconomic status as being a key predictor of CKM syndrome and complications from it, but also there's certain backgrounds like South Asian ancestry that we know have unique relationships with a high likelihood of developing CKM syndrome and complications. And then there are several sex-specific factors like premature menopause, polycystic ovarian syndrome, adverse pregnancy outcomes, and erectile dysfunction, all of those that are also big indicators of risk. I'll also point out that gestational diabetes is something that we've actually specifically called out in stage 1 of CKM syndrome, just because those individuals have such a high risk of having insulin resistance and progression of diabetes. So we actually put them in stage 1 in terms of our screening approach for that population. So these are really all important because we want to make sure that while we have all these algorithms, we know that everybody's an individual patient, and we want to make sure that we, where we can, personalize our approaches for them in a way that best reflects their circumstances and their level of risk.
And like you said, when a woman develops a condition like preeclampsia, that is a failed endothelial stress test right there. And when you then project into the future and look at the cumulative risk of stroke or kidney disease, especially in those with recurrent episodes of conditions like preeclampsia, these are women that give birth to babies and then nobody is following up on, are they developing proteinuria? Are they developing diabetes? And many of these are already starting out after the pregnancy at stage 2 CKM. And I really think that's an important point to make.